You're listening to Bold Enough to Ask, a Breathe Strong CF podcast that tackles questions for people with cystic fibrosis. Breathe Strong CF empowers the cystic fibrosis community to thrive, not just survive. I am your host, Chad Bouch, a dad living and thriving with CF and an advocate for the CF community. This first season of Bold Enough to Ask is going to focus on the questions men with CF have around sexual and reproductive health. Today, we're talking to multiple guests about the topic of sexual function. Approximately 65% of men with CF report experiencing sexual function issues, yet so often we are avoiding the topic of in and out of the clinic. This episode will cover those uncomfortable conversations, tapping into things such as delayed puberty, impacts on libido, how diabetes is connected to erectile dysfunction, and how men with CF practice safe sex. To start, we have Dr. Justin Dubin. Dr. Dubin is a board-certified urologist and the director of men's sexual health at Baptist Health Miami Cancer Institute. We also have two brothers with cystic fibrosis living in California, Abhijit and Shrivas Terumala. Abhijit is 24 years old and his brother Shrivas is 29. Welcome and thank you for coming to this uncomfortable conversation. We're going to jump right in with Dr. Justin. Dr. Justin, welcome to the podcast. Thanks for being here today.
Thanks for having me. I'm real excited to be here. Great platform that you've created for people who are diagnosed with CF. And I'm just happy to be part of helping educate and normalize conversations around these kinds of topics we're talking today.
I love it. So Dr. Justin, you are a urologist. Give us a little bit of background about you in urology.
Perfect. So a little bit about me. My name is Justin Dubin. I'm originally from New Jersey. Did my undergrad at Johns Hopkins in Baltimore. I did my medical school at Rutgers, Robert Wood Johnson in New Jersey. And then I did my urology residency at the University of Miami down here in South Florida. And I decided after being in the umbrella of urology that I really wanted to focus on men's health. That includes male infertility, sexual medicine, testosterone, erections, ejaculatory issues, testicle pain. And I became really passionate about it because for me, a lot of medicine, and I think most people associate medicine with this idea of like, I'm going to the doctor so I don't die. So I'm just going to take these medicines so I don't die, so I can live longer. And I often think we forget about the quality of life that we're living. And when I looked at the men's health space, you see people who are struggling with their fertility who want to create life with a partner. It's the opposite of preventing death. And you also have people who are living longer lives than ever before, whether it's CF patients, cancer patients. But we want to make sure that that life is worth living. If you want to have a good, satisfying sex life throughout your life, you should be able to. If you want to have the energy and the motivation and the desire for your life, you should. So a long life has not always equaled a good life. And I think that by bringing in the men's health aspect, I can hopefully guarantee or make the best of that life that you have and make it the best quality life. So what I decided to do was I did my fellowship in men's health, male infertility, sexual medicine, andrology at Northwestern in Chicago for a year. Love Chicago, all-time city. And I decided to take my talents back to South Florida, where I originally was at Memorial in Broward, and now I'm currently the director of men's sexual health at Baptist here in South Florida, and we're creating a residency program. We're going to be doing some training, and I'm just really excited to be part of the South Florida community where I can give back.
Love that. Love the reference. I caught it. So I love how also you talk about quality of life versus quantity. There was actually a time in my life, probably 13, 14 years old, where I wrestled with that. Like, why am I spending so much time doing treatments? Why am I spending time so much doing all this stuff? It doesn't really matter in the end. I'm going to die anyway. So why not enjoy life? But thankfully, I didn't listen to myself and I had a smart individual talk some sense into me. So I really do like that. That happened probably shortly before or shortly after puberty. Speaking of men's sexual health is kind of where it all starts. So I want to ask you a question. Is just because we start to see big differences in men and boys when that happens, how often or how does CF typically affect puberty for men? Or boys,
Yeah.
I guess.
So it's an interesting question, and it's actually an important one to understand because when you look at what young men or young boys even with CF deal with, right? You have a couple of things. You have one, the malnutrition aspect, you have the chronic inflammatory aspect, and then you have the progressive pulmonary disease, which is a combination that is not always good for growth and puberty. So it is not surprising to hear that a lot of men who have CF do have some delays in puberty. Now, what the good news is that although there are delays in puberty, sometimes you can have a delay by a year or two, sometimes 6 months. Most men eventually do achieve normal puberty, have normal development, but it may take a little bit longer, especially if they're not getting the appropriate treatments to address the issues that I brought up. But, CF does tend to really reduce that progression if unchecked.
So this is where I really learned growing through puberty, where I really learned about my lack of a vas deferens. Don't know why it came up then. It just did. I was not necessarily a wise individual with that information when it came to me pursuing relationships with females. Often would date and eventually have intimacy with them and not have condoms, not wear any kind of protection. Not smart. So if you are at my age and you're listening to this, don't do that. Because there's so many things that
100%.
can come into play on top of that with sexual diseases and all that fun stuff. So don't do that. But that's really where I started learning about my lack of vas deferens, and I wasn't necessarily the best use of that information. But so we know, as we've talked throughout this whole season of podcasts, we know that CF patients don't have a vas deferens, which leads to infertility. I'm sorry, not infertility, because we can have kids.
You're sterile. Sterility, not infertility, is the medical way we like to think about it.
Great. So what other sexual functions can be impacted by our CF?
Well, I do want to acknowledge the unprotected sex part, right? I think we were going to get to that, but I think you already brought it up. So I want to acknowledge that just because you can't have a child doesn't mean you shouldn't be using condoms. There's an alarmingly low rate of usage of condoms in the CF population. When they surveyed them, I think over 75% of men with CF reported never using a condom.
Wow.
And, for CF patients who have had like at least two partners in the last year, 36% said they never used a condom. And that's compared to only about 16% of men who don't have CF. So it's like literally the lack of usage is over 2 times higher
Wow.
in men with CF. And we have to understand, I get it. You're not able to have a kid, but there's a lot of other things that you can get, right?
For sure.
A lot of STDs, a lot of more permanent STDs that can be problematic for your immediate health, can be problematic for your long-term health. So it is very important that while you cannot achieve a pregnancy through sexual intercourse, you can achieve acquiring many other problems.
Sure.
Highly, highly recommend using protection, using condoms.
Yes, I agree. Do as I say, not as I did, please. That was a very poor decision making on my part.
Hey,
So
you're good. That's the way
exactly.
it goes.
So then other sexual functions that could be impacted with our CF.
Yeah. So inherently, when we look at any sexual health issue, our testosterone, a lot of our argument in the space for urologists and men's health space, people say you can use two markers. One, people argue that your sexual health, your erections are the greatest marker for your overall health. And some argue that your testosterone levels are great markers, are the best marker for your overall health. I would argue that all sexual function is a marker for your overall health. And anytime you have a chronic disease that includes chronic inflammation, malnutrition, puts you at higher risk for things like diabetes, you're going to be more at risk for having sexual health issues. So it's not surprising to hear that testosterone deficiency, having a low testosterone, which is associated with signs and symptoms like low energy, low sex drive, erectile dysfunction. It can affect almost 50% of CF men who get tested, 30 to 45% or so. And so that's a common issue. And also sexual dysfunction in terms of erectile dysfunction. The data suggests that at least 20% of men with CF have erectile dysfunction. I would argue that's a low number because, 50% of men at some point in their lives struggle with erectile dysfunction. So, I think it's fair to say that this is a very common issue that most men deal with. And as a cystic fibrosis man, sometimes you may have additional health issues, additional stressors in your life that can definitely compromise your erections as well. And, I think that when it comes to like a bigger picture thing, one important aspect of our sexual health that is never addressed, any man, let alone cystic fibrosis, men who are diagnosed with cystic fibrosis, is the mental health component, right? To quote Robin Williams, he said, God gave man a brain and a penis and only enough blood to control one at a time. And he's absolutely correct. So, if you're dealing with issues where you're told you have infertility or sterility, that you can't achieve a pregnancy naturally, or, does that question your masculinity or your relationships with a partner? That it can create a lot of additional stressors in your life that can absolutely compromise your testosterone levels, that can compromise your erections. So, anyone who is struggling with CF or the diagnosis or relationships, I always recommend you're seeking a therapist, a sex therapist, or relationship therapist. And this is just another level that I think we just don't talk about enough. And this is coming from a urologist, right? And I think it just is so pervasive in so many aspects of our lives, including our sexual.
Yeah. I want to go back to something. You said that the CF related diabetes, I'm sorry, CF is related to erectile dysfunction. He says 20% of CF patients, which is arguably low because across the country it's 50% of men. I wonder though, now that CF patients are living longer with the advent of all the modulators, and I know I get percentages are percentages, so it's just a small number, but as that population grows, in theory, would our percentages also grow now that we're able to test more men?
I would argue it's kind of a fine balance, right? As we're treating and preventing, we're controlling the diabetes at a younger age, right? Cystic fibrosis associated diabetes or related diabetes is affecting about 20% of adolescents, right? And about 40 to 50% of adults. So statistically speaking, most CF patients are going to deal with some aspect of that. But as we have a better grasp of that and understanding and we get our sugars under control at a better time, I think, we can prevent a lot of the issues of erectile dysfunction. But you're right. Inherently, as men get older and cystic fibrosis patients live longer, you're at higher risk for all of these comorbidities that most of the population have, right? 40% of men in their 40s, 50% in their 50s, 60% in their 60s, 70% in their 70s. You get the idea, have
Yeah.
erectile dysfunction. 20 to 20% of men under the age of 60 have low testosterone, 30% in their 70s, up to 50% in their 80s have low testosterone. So you just eventually become a normal statistic, but maybe a little bit higher prevalence because of the chronic issues that you have been dealing with. So yeah, is it going to be more common as you get older? 100%. Is it because of the disease? Maybe, or it could just be with the acquisition. What we like to say is the acquisition of other health issues as we get older.
Yeah. So I know this sounds weird, but explain to me a little bit how the CF related diabetes or diabetes in general, how that translates into issues with getting an erection.
All right, I'm going to break this down for all of erections. Okay. So, what I like to explain is in order to get a good erection, you need five things. Any of these five things go wrong, you can have erectile dysfunction. One, you need good blood flow to your penis. What can compromise that? Smoking, vaping, surgeries like prostate surgery, diabetes, all right, can compromise your vasculature. Heart disease. We say that heart disease is erectile dysfunction is a canary in the coal mine, meaning it's an early warning sign for future heart attack, stroke. There's a lot of good data because the vessels in your penis, I don't care how big it is, are much, much smaller than the vessels in your heart. So if they are clogged and you're not getting good blood flow to your penis, there's a good chance that somewhere down the line, the vessels in your heart will also get clogged. So that's number one. Number two is you need good nerves. What compromises that? Diabetes is a big one, right?
Yeah.
When we think about diabetes, we typically think about, neuralgias, right? Of our hands,
Yep.
our feet, our eyes. But guess what? Once again, the nerves in your penis, much smaller than those in your fingers and your hands. And it's often an early sign of poorly controlled diabetes or long-term diabetes is erectile dysfunction because it's damaging the nerves that you need to engage in sexual activity and to stimulate your erection. Other things, surgery, prostatectomies, things like that, trauma, But, diabetes is the big one for your nerves. Number
Yeah.
3, you need good testosterone levels. We've already established that a lot of men have low testosterone levels. We know that men with CF are at high risk for having low testosterone. Now, testosterone is not the strongest thing. If you treat low testosterone, it can assist with your erections, but most of the time, it's not the thing that's going to get you over the hump. Not to be punny, but I'm punny. So it is something that needs to be addressed. Number 4 and 5 are the supratentorial ones, the ones in your head, right? 4 is funny, but it sounds like, you have to be aroused. So a conversation I often have with my patients is everything going okay at home? Are you having a good relationship with your partner? And you'd be surprised where people say, we got in a huge argument. I think I'm going through a divorce. Yeah, you're probably not going to be wanting to have sex with that
Yeah.
person if you're going through that, right? And there's a lot of relationship issues that can come up, whether it's just being a normal person, the stresses of, other things. And then the last thing is you need to be in a good state of mind. Stress, anxiety, depression, unfortunately, medications that treat those things can cause erectile dysfunction, ejaculatory issues. And so for a lot of those things, I recommend seeing, like I mentioned before, a therapist, psychiatrist, sex therapist. And those tools are vastly underutilized. So as you can see, there's a lot of things that can impact your erections, and that it is a really great marker for your overall health. And we talk about all the things that can compromise your health as a cystic fibrosis patient. It's really important that we're addressing them all if we want to have a good, long sex life.
That's great. Really good information. I really appreciate that. I know we talked about the importance of practicing safe sex and how we could avoid all the diseases and all that other stuff. And this is probably gonna be a better question for other two guests. But when you are working with CF couples, you at this point, they've already probably been married for the most part, and you're working with the CF couples as far as the IVF type stuff. Is that right?
Yes.
Okay, we'll say that then for the next two guests. So let's actually bring them on right now. Shrivas and his brother Abhi are joining us. Super excited to have you. First time we've had brothers on the podcast, so I'm excited to talk a little bit about growing up with two CF people in the same household. Shrivas, let's start with you. Tell us just a little bit about growing up, what it was like, and just kind of give us a little bit of background on your CF story.
Yeah, yeah. So a quick intro on myself. I'm Shrivas, 29 years old. I have cystic fibrosis. Currently live in the San Francisco Bay Area, but was living in New York for the past 5 years, which is an exciting change of pace. But yeah, excited to be back since I grew up local here, and yeah, the last year has been a lot of changes from moving. Also, recently got married, so my wife and I both moved here. So yeah, it's been great. But yeah, in terms of our childhood and growing up, right, with my brother Abi and both of us having CF. To be honest, yeah, I was reflecting on this question and yeah, just looking back over the course of like our childhood. Overall, I would surprisingly say it felt like pretty normal, right? Where we, were able to go to school, able to participate in a lot of sports. We both loved baseball growing up, so both of us played baseball. And yeah, I think overall, like our parents did a good job of trying to enroll us in, as many hobbies as possible and making us, I would say, like as active as possible. So actually, a big thing that I think helped contribute as well to my, I would say, lung function was playing the clarinet. I played that for almost like 7, 8 years, right, from the time I was 9 to all the way through high school. Obviously, that requires a lot of exertion on your lungs, and I think that actually helped a decent amount, right, with just lung function in general, combined with the fact that I was also younger. But I think, yeah, having, growing up with Abhi and both of us having CF, I would say, I actually don't, looking back, think there was a lot of like second thought in terms of like us having to like avoid each other. Like if we were sick, obviously, if one of us was like feeling down for a temporary period of time, we would try not to interact with each other. But overall, there was never any like, I would say, distancing guidelines that we were given. I'm not actually sure if the literature says that, that's different today. But overall, from the advice from our clinic, right, was that I mean, you're already growing up in the same house. You've probably been exposed to the same bugs and to the same, sort of pathogens. So yeah, so I think from that perspective, like it was nice that we were able to have a pretty normal childhood, and I think it was really nice that I mean, not that it's stressful for our parents for sure having two kids with CF, but I think the fact that we are able to take solace right in the experiences that we go together. We would go to clinic together, see the same doctors, right? It was kind of like a family affair with our pediatric clinic. So I think having someone else going through that with you makes it or made it right a lot easier as a kid, and you didn't feel like as different, right? I think especially if you have siblings that don't have CF but you have CF, I can imagine how much more isolating that would feel. So I think in a way, it's both obviously a curse to have CF, but at the same time, a blessing in a way for to have someone else, right, go with that journey with you and not have it be entirely alone.
And just to clarify too, it's just the two of you. You have no other siblings.
No, no, it's just the two of us. Yeah.
Great. And then give us a health update right now. Like, where are you at? How are you doing now?
Yeah, yeah. Overall, yeah. I mean, doing pretty well, I would say for myself. Lung function wise, like typically it hovers in like the mid 60s to like upper 60s. But overall, still able to keep a healthy, active lifestyle. Trying my best to participate in as much like physical like activity as possible. It's obviously a lot harder when you get older. Just given right the fewer activities that you have to bond with people over such activities. But yeah, overall, still continuing to do well. I think as I've gotten older, right, I think I was fortunate when I was younger to not have like CF really stand in the way of what I wanted to achieve, right? I was able to go to school away from home for college and was able to do like, traveling and stuff. But I think as I've gotten older, I can definitely feel the effects of it a bit more. And I'm a lot more, I would say, stringent, right, with my routines and making sure I don't fall off the wagon when it comes to upkeeping my health. And I'm a lot more particular about that. But yeah, overall doing good and trying to do the best that I can to keep that up.
Awesome. Abby, I want to know if you'll echo those sentiments growing up. How was it for you being the younger brother?
Yeah, I definitely want to. I would say I echo a lot of those sentiments that I think Shiva shared. I think looking back now, definitely in hindsight, I would say that I was privileged enough to be able to have a relatively like healthy upbringing, especially in my early childhood, up until I would say around like the end of middle school, which I think are very formative years of you being a kid. Like I was very privileged enough, as Shiva said, to play baseball. We also played soccer. And then, yeah, I think what Shiva said also as something that I very much resonate with was having somebody else that's kind of going through it with you. I think, he's definitely been a sort of light or guidance for me where, I can see him kind of going through a stage of life that I may go, through a couple years from now. And so being able to see him and see the issues that he's dealing with kind of gives me a good heads up of what might occur. But what I also think is so interesting is I think CF has affected us in different ways in terms of like types of organ systems. Like as you mentioned, Chad and Dr. Dubin, like I mean, CF obviously affects so many different domains of our body. But for me, I've had a lot more like pulmonary issues. Well, I know she also struggled a little bit more with at times GI or ENT. And so it's interesting because even though him and I are probably the most genetically similar people that we could be to each other, like on this planet, yet we're so different, which I think sometimes speaks to this to sort of overall like isolating nature of CF. But I would say, like, definitely looking back, like, had a pretty, privileged childhood to where I could do what I wanted and didn't feel limited necessarily by my health as much.
And we just got done hearing Dr. Justin talk about puberty and how it might affect some delays and whatnot with our CF. I mean, let's stay with you. Did you, like, looking back, do you feel like your puberty era was normal? Looking back, was it maybe delayed? What are your thoughts on that?
Yeah, I mean, I think it's hard to say whether or not like I had any issues with that. Like I never had anything brought up by my care team in that sort of sense about me having any issues with that.
Good, good. Shrivas, any thoughts on that?
Yeah. Yeah. I mean, I think it was when we were growing up, there was always a concern, right, that we were underweight. I remember more than the focal point. I remember at our pediatric clinic visits would be actually more so sometimes in our BMI and like our weight gain versus like obviously there was a big focus on the lung health, but I distinctly remember always being called out for like I'm not eating enough. I'm not doing enough to like upkeep my weight. That was like a big struggle. I remember like, our mom taking us to many different nutritionists to like get on these very intensive, like, weight supplements like Ensure and Scandy Shake and stuff. But yeah, I think in terms of the CF affecting like puberty, I think, I always felt like I was the underweight kid, even like playing baseball growing up. Like I always just felt like I was like the smallest kid amongst a bunch of giants right at the time. But I was never sure, right, if that was, purely CF related and maybe also just genetics. I think overall, and like also being like South Asian, I think sometimes South Asians tend to like maybe lean towards being a bit more skinny, right, at times, and especially within my family as well. But yeah, I think for sure, right, there was a big emphasis in terms of like weight gain, and I'm sure that played a role, right, in how
Yeah.
we developed as kids and in teenage years.
So the two of you are in very different stages of life when it comes to relationships, right? So Shrivas, you're married, just got married, you said, I think just a little under 2 years ago. And Abby, you're not married, in a relationship, dating. So let's talk about just that aspect of what we've been talking about. So we know we've learned a little bit today about the importance of a satisfying sexual life as far as it comes to our own mental health and all that entails. So, Shrina, starting with you, I want to ask you first about when you and your wife were just dating, how did that conversation come up or how did that conversation go when it came to you talking about cystic fibrosis and what the effects that plays in your life, particularly when it comes to starting a family?
Yeah, yeah. Yeah, I mean, I think definitely approaching that conversation with my wife was pretty nerve-wracking, right? To be honest, actually, up to that point, I hadn't really had a serious conversation with people I've had past relationships with about my CF in general, because I think it was in a place where it was pretty stable and I didn't really have to pay attention to that, right? But as I got older, as I had to upkeep it more, yeah, it definitely became something that we needed to have a conversation about. And yeah, I think the first time we had the conversation, it was, you know, a lot more like inquisitive, where she was trying to learn. Obviously, she had done her research online, but sometimes I think, right, like what you read online can scare you a lot more than the actual person, because it's such
For
a
sure.
specific disease, right? Like each person goes through such a different experience. So yeah, so trying to calm her down, and be like, I mean, like I get the literature out there, but for me so far, like knock on wood, I'm doing pretty well. So and obviously it doesn't really outwardly show, right? Like people are very surprised when they find out that I have CF, or they're like, oh, like you don't look like you have CF at all. But I definitely, it was a very anxiety inducing conversation, and very fortunate that she took it with an open mind. I know some people, right, may not react well to that, knowing that you're in a relationship with someone who, right, in their mind may have like an earlier expiration date than yourself. So yeah, so I think being able to like find someone that, and obviously you want to be with someone, right, that is very understanding that way, and is willing to have that open conversation, rather than someone where you feel like you're playing the role of having to apologize for yourself, right? Because at the end of the day, it's something that you have to deal with. And I think at the end of the day, it's like you should be with someone that also understands their perspective too, right? So I think that was very helpful in having to navigate that together. Yeah, and when it comes to even like family planning and stuff, right? As Dr. Dubin said, it's not like men with CF are infertile, right? It's just that you can't, most people, not, yeah, 99% of people can't have kids the natural way. So it's obviously, right, there's more effort involved with having children, but the fact that there is a path forward in terms of trying to have children, it was promising, right? And I think I didn't like dissuade each other from having that conversation, because at least that there is a future in terms of that.
Yeah, for sure, and that's great. I also remember having that conversation with my wife. We've been married, it'll be 30 years this July, and yeah, she understood it. But keep in mind, like this was really before the internet, right? So she wasn't able to consult Dr. Google. So she really just had to trust everything I was saying without going to the local library and pulling up an encyclopedia or whatnot to hear about it. So, all right, Abby, you are in a relationship. Obviously, no one knows the future, where it's going to go, how long, what's that's going to look like. Have you chatted and have you had a conversation all about your health?
Yeah, I would say definitely just for me, I've always felt like I've been a lot more forthcoming about me having CF. And I think a lot of that also stems from the fact that I have missed a lot of time, like in school and college, and even now, like just sidelined by my health. I'm someone that since high school has pretty much been hospitalized like every year since probably like 2017. I was actually counting it before the call, but I think it's been like 9 or 10 hospitalizations that I've had since like 2017. So like naturally, like even in high school, for example, like there were moments where I would just like disappear for like a month, and everyone was like, "Where'd you like go?" And like, "Are you okay?" So I think like that was always something that people have known, that there was something like that about me, where I had other external circumstances. And even what Shiva said, right, like CF is such an invisible disease, and it is so like taxing on people, but yeah, like you couldn't, like, unless someone was on like supplemental oxygen all the time, like you just wouldn't know that that person was dealing with something as burdensome as CF. So I think for me, like, just I think the way that like I've been a lot more like involved in community advocacy. So like I think now it's pretty well known, like especially because I posted on social media and stuff, that like CF has been, like I do have CF, and this is like what I'm about. So I think for me, just generally to give that context, like I am forthcoming, and I feel like that's something that I've revealed pretty early on to people, like even when I'm just like dating someone like in a very early stage. But I think, yeah, for me in this current relationship, like it has come up. And I think like now I'm kind of learning that, this being like kind of my first like proper adult relationship since I'm only 24, like it affects you just not only in the current moment, but just into the future. And so, yeah, I think I've, done a good job of trying to explain to that my current partner, and she's been very good at, having those conversations and just asking me from a curiosity lens. And I think similar to what Shiva said, I think naturally if you go onto Google, or if you go onto, ChatGPT or whatever, you hear stories about people passing away really young, which obviously has happened to many patients, and so on and so forth. But I think for me, just like I've been able to still live like a pretty good life. But I think where CF has kind of affected me when it comes to dating is more of just my own insecurities and things like that, and maybe assumptions that I make. Where, for me, like it's very hard with my health history of just being hospitalized and being sidelined by my health. Like I can't really make like drastic decisions where I can just like move, somewhere super new, like immediately. Like I am very, stuck into my care system. I am followed by a lot of different providers. So a decision like that just takes a lot or requires a lot more thought. And even with traveling, like traveling for me is something that's kind of difficult where I can't go anywhere like super remotely because of any fears of having a medical emergency, which has happened multiple times in the past. And I just am someone that needs my treatments a lot more than often. And so I think for me, like I just naturally have been someone that's more forthcoming about it. And I just think that I'm learning the sort of ropes of how to have that conversation in a mature manner and kind of how to make it less scary for the other person. I mean, we obviously deal with our own insecurities of maybe having worries that someone may leave you for it just because it is a bit of a daunting process. But I think I've done a good job of just being more open and forthcoming. And I think a lot of that has also helped with me being involved in advocacy and just seeing other older CF adults who have been with partners for very long times and knowing that there are people out there that are willing to make that commitment. So I think that's kind of something that's helped me reframe my perspective on that conversation.
That's great. Really good. Okay, so as we are getting older now, you said 24 and 29. And so as we grow up, obviously, as Dr. Dubin explained, more stuff happens. So, Shrivas, have you had any kind of discussions with your wife about genetic testing for her? Is that where do you at that? I know you mentioned, I believe, that you eventually would like to create a family. And so what have you done as far as um, educating her on what that looks like, the possibility of having a CF child and whatnot? Tell me a little
Yeah.
bit about that aspect of your relationship planning.
Yeah. So, pretty newly married. I think the conversation of kids is still some time away, definitely, just from a personal note. Um, you know, before I delve into that realm. But yeah, I mean, in terms of genetic testing, for sure. Yeah, honestly, I would actually say maybe this is something we should have done earlier. And to be frank, we haven't actually gotten her genetically tested yet, right, for CF. So I definitely, before we even decide to have kids, that's the first step that we'll be taking, and probably something that we'll do in the coming years or so when that conversation becomes, more apparent and more frequent. But yeah, definitely, it's obviously extremely important to get genetically tested. Right? I not that I've made any decisions based off of what her diagnosis may be, if she's a CF carrier or not. I think right, it definitely impacts the way that, at least in my opinion, right, one's decision may have on knowing, like, if let's say your partner is also a CF carrier. So I think that's a road that we'll have to cross if we get there. But I think it's something to keep in mind, since having gone through this disease as well, is that something a risk you're willing to take too, right?
Yeah.
By having kids who could also have had the same disease as you.
Yeah. Yeah. It's a huge conversation. It's a huge topic point for many people with CF. I know a lot of people like to debate both sides, and honestly, everybody has their own opinion and they're entitled to whatever they think and do about that stuff. It's a
May I just comment for a second? Because I think
absolutely.
it's really an amazing point. One thing that you do have to know though is there is this magical thing about going through IVF, because you do have to inherently go through IVF, that your team will screen your partner and you will have inherently, no matter what, see if say, she is a CF carrier, you will have the ability to identify through that genetics process whether that child will be a CF carrier versus CF. We've come so far that it's pretty amazing that you'll have some ability to make those decisions together, and it's not going to be a blinded process. I just wanted to comment on that, but thank you for sharing.
That's a really good comment, because I know back when we went through this 16 and 25 years ago, that was not something we did. We did not have that choice. We did have her screened prior to us even getting married, um, to see what that situation was like, even though we knew going in that IVF was going to be our only route. But we did still have her tested before we got married and screened. But you know what? It doesn't necessarily help your mentality. Like, I know with our first child, we knew that my wife was not a carrier, but we still went through a sweat test because it's just a peace of mind thing. So we've dealt with all of this disease stuff in the back of our minds, in the forefront of our minds, our whole lives. And for our spouses, it's new. And so bringing, we agreed to sweat test of all three of our kids, and but is really more for just her peace of mind than anything else. Because again, it's a lot newer for them than it is for us. we've dealt with it the whole time. So, all right, I want to open up the floor to the brothers now to see if you guys have any questions for Dr. Justin, anything that you want to prime. I do want to start though with a simple question for both of you. I want to talk about like primary care providers versus CF team versus other teams. I know, Abby, you mentioned you have a number of teams. Do either of you have a relationship with a urologist yet?
I currently don't, and that was actually one of the questions that I wanted to talk to Dr. Dubin. Sorry, I just muffled that completely. But I think that was one of my questions. Is naturally, as you guys were mentioning, it's really important for young men to obviously be wearing condoms and using protection. Even outside of the fact that they may not be able to get someone pregnant. And I just think a general question that I had is, how is that, like, how early should that process be for young CF men or just, CF people generally to get connected to urologists? Because I think naturally I recently shifted to adult care about 2 years ago. And that's something that I noticed where I felt like when I was a pediatric patient, I was able to tell my CF team anything and then they would connect me with whoever. But I feel like now a lot of the ways that I feel with my adult center is more of like you tell them something that maybe is a little outside of the realm of direct pulmonology care. And then they say, oh, you should maybe go down your go down with your PCP instead of maybe, going through it with us. Even though our team has been working really hard on wanting to improve, reproductive health and sexual health and get the connections that patients need and help people with that sort of topic. I think naturally I wanted to just ask you generally is like, how do you think that patient should go about getting urological care? And, are there symptoms that they should be feeling? Is this something that you should just kind of establish kind of post puberty, just to have that sort of consistent, maybe annual care? I think I just wanted to get your thoughts on that, Dr. Dubin.
This is a really important topic. And Chad and I had spoken about this a little bit in our conversation prior to the podcast. And this is a great, great question. And I think the most important thing, first off, we have to understand is exactly what you said, is that while your CF team has been your primary source of care, they are only trained to certain degrees of their ability to manage you. And I think that at some point you have to advocate for yourself and say, hey, listen, I think I'm at an age where I have these sexual health concerns. I have these fertility concerns. I want to learn more about these things. And that you can say, hey, can you connect me with a urologist who specializes in men's health? And the benefit is typically when you're at a CF institution that manages CF, they usually have the subspecialists like myself. So you have that access to those, men's health specialists, the fertility specialists in New York, SF. There are a whole bunch of them that I could list off. But and that's one of the benefits of having that CF network in your institution. But, I think the answer of the question of when really depends on a couple of things. One, I want to make it clear that urologists do not deal with STDs or anything, right? That it will be your primary care doctor. But while you are becoming sexually active, you've, gone through puberty and you're above the age of 18, anytime, we used to have this old thought process, go to the doctor when there's something wrong. And the problem with men is that we don't have, that stalwart of care as we go through our lives. Women, they are taught at a very young age to, to see their gynecologist on an annual basis once they pretty much hit puberty. Men, we don't have that. And so I really encourage anyone who is interested in their health and interested in their sexual health and their fertility, which, as we know, is compromised to some degree by CF, to go as soon as you're interested in learning more. We know that you're at higher risk for having low testosterone. And we've already established you may have a little bit of delayed puberty. Now, that doesn't mean that you have low testosterone. It might just taken you a little bit longer to get there. But I think it's any opportunity for you to learn more about your health is a great opportunity. If you're saying, hey, I'm more sexually active, I want to make sure my erections are as good as they should be. I want to make sure that, my sexual health is good. I think that when it comes to CF patients, you walk in my door, I'm going to do a full hormone panel on you, make sure that everything is optimized because, most of the time I find low testosterone in guys who have CF. And, maybe your baseline of how you feel, you've had it your whole life, that you don't know how you actually should be feeling because your testosterone has been low for as long as you've known. So, there's no right answer. There's no wrong answer. But I think if you're ever interested and you know that you're a cystic fibrosis patient who's at higher risk for these things, I think the sooner then later you're coming the better. And especially when it comes to fertility, right? Because although, we can't test your sperm count, we do know that your fertility is something that we need to evaluate. And that includes a hormone panel, and that includes addressing other lifestyle things. Because although your sperm is not accessible through ejaculation, it is still in your testicle. And that means that lifestyle factors can impact your sperm quality. So what I like to say is that, when you're starting the family plan, you really need to be planning at least 6 months prior to before even trying to think about having a kid. Why? The sperm cycle is at least 3 months, is around 3 months. So anything you do to positively impact your sperm takes at least 3 months. Anything that you're doing to harm your sperm quality takes at least 3 months to recover. And so if you're going to see a doctor and you're starting a family plan, say, I need to get a sperm extraction, and then we find out you're doing something that could compromise your fertility or your testosterone's low and we want to optimize your fertility, we're talking about delaying your family planning several months down the line. So active care, active interest in your sexual health and your fertility will really save you time later on for your family planning and overall improve your health. We know that men with low testosterone have a higher risk of dying at a younger age, have a higher risk of acquiring worsening issues like heart attack and stroke. So why, if you're someone who you're at high risk for these things in the first place, not go see a doctor to get checked out?
Great insight. Great question, too. Thanks, Ali. Shrivas, you have anything you want to talk to the doctor about?
No, thanks for that tip, Dr. Dubin. Yeah, I think, myself, I've been guilty of, not having a PCP for a while. So my CF clinic used to be the go-to place, right, for all a variety of problems. But yeah, definitely been trying to prioritize, especially right as you get older. Now that I have like a gastroenterologist, right, GI doctor to go see for any pancreatic related issues, and yeah, definitely want to prioritize, right, especially as I get older, too, seeing a men's health doctor because I think, as you said, right, like low T can affect a variety of issues, and even I'm at risk for like osteoporosis, so making sure that I keep
Absolutely.
that under the wraps because last thing I want to do is introduce right a new issue that I have to deal with. So yeah, I had a generic, just like interesting question. What is the reason as to why like men with CF don't have vas deferens? Like, what about the biology of it? Does it remove that functionality? I've just been curious. Like, is it like sort of an evolutionary thing? I was wondering, right? Like to prevent procreation for people with CF.
No, it's an embryological defect. Now, it's been a while since I've reviewed this, but my belief is what really happens embryologically is that tube is very, very thin. Remember, when you develop a lot of mucus, it's removal of mucus and all the stuff that is associated with CF. And what typically happens during with CF patients is that very thin vas deferens gets clogged and it actually just atrophies during embryo formation. It's not an evolutionary thing. It's truly strictly an embryological result of the CFTR mutation that is preventing the formation or the continued progression of the formation of the vas deferens on both sides.
I actually had
Interesting.
one
Thanks.
more. I had one more question for you, Dr. Duman, kind of going back to our first point,
Ask away, man. Ask away. That's what I'm here
and I
for.
obviously really appreciated your input about kind of men taking control of their health more from preventative lens. Just because for me, that's the way that I kind of look at medicine, especially as someone that, is interested in wanting to become a physician. And I think generally a question that I wanted to ask for you was when you were talking about things like sperm count and obviously testosterone going down, which is I think a function of is that kind of seems like an age related thing, but kind of could be compounded in people with CF since they already have low testosterone to begin with. Like, what are some things or advice that you would give to young men with CF, even without CF, that are kind of factors or lifestyle factors, as you said, that kind of could affect just, or that are kind of destructive to just sexual function overall, throughout their 20s and even beyond, if you have some time to talk about that briefly?
Absolutely. This is a beautiful question. So there's a lot of bad information online. There's a lot of looks maxers, T maxers, sperm maxers. There's an article I just saw in GQ about sperm maxing. But, and a lot of people out there are saying that doctors don't promote health. They want to give you medicines. And it's further from the truth than you can ever imagine. And the truth is, the best things you can do and to improve your testosterone are quite simple. One, exercise. Resistance training, more than cardio, but we always encourage cardio, really does a good job of improving your testosterone levels. Number two, eating a healthy diet. There's a lot of different diets out there, but you really want to make it a lifestyle. But the most studied is usually the Mediterranean diet. But I think as long as you're eating healthy, you're decreasing processed foods, whole fruit, whole vegetables, whole grains, getting your fiber, especially for you guys, fiber obviously very important. It is really important for your testosterone levels and your overall sexual health. Number three is getting good sleep. That is one that I struggle with. We all struggle with 7 to 8 hours of sleep at minimum. Now, our testosterone levels actually regenerate in a circadian rhythm with our sleep. And we know that people who have poor sleep habits or have shift work, police officers, firemen, they're at higher risk for low testosterone because they're not getting their testosterone back when they're sleeping. And that's why, testosterone is traditionally highest in the morning, which is one reason why we have morning erections, why people love morning sex, because of that high testosterone in the morning. And then the last thing is the easiest thing to say, hardest thing to do is decreasing stress, right? Stress, anxiety spikes your cortisol levels. I know cortisol maxing, cortisol, all that cortisol spike you see with all that stuff online. There is some truth to it inherently, right? High stress levels will increase your cortisol, decreases your testosterone. So these are the pillars of health, right? Obviously, not smoking, not excessive drinking, treating your body well now so that you can live a good long life later is key. And I think that it sounds simple, and I understand, and this is where the problems arise, right? It sounds simple. It's easy to say all of these things, but remember, there's a lot of people out there struggling. We've known this to be the truth for however long humans have been around, and yet, we have more people sedentary than ever. Obese, diabetes is rampant, testosterone's low. Everyone's learning about decreasing fertility rates. The point is that if you can't get that done by yourself, especially as a man, and we talked about why having testosterone or addressing your fertility, addressing your testosterone is important, go get help, right? Talk to your primary care doctor, talk to your urologist, because there's a lot of things we can help you with to get you where you want to go. And, especially you guys are lucky. I think, a lot of times you can get linked in with a nutritionist. That aspect is really valuable. I would always recommend. We can send referrals for nutritionists, trainers, things like that can really go a long way. I can't tell you how many men I send for sleep studies all day, every day, because they have sleep apnea and things like that. I'm not sure if you guys if CF patients are at high risk for sleep apnea. Maybe you guys could tell me that. I don't know, Chad, if you're familiar with that.
I just know that I've been tested for it and I'm a negative. So
Okay.
I have actually sleep apnea, so I did a sleep study and I do use the machine. I'm pretty
So there
bad
you go.
endurance,
Higher
but
risk
yeah.
for low testosterone
here
if
we go.
you have sleep apnea and you don't treat it. So, these are all little things that we don't realize impact our testosterone, impact our erections, impact our sexual health. And really what I like from me as a urologist and a men's health specialist is we already know men are thinking with their penises. I want them to think about their penises. And when they think about their penises and how their overall health drives their sexual health, I think a lot more people are going to get into the doctor. They're going to try to get healthier because they want to live a longer, happier sex life. They want to have the kids. You want to be the best man that you can be. You want to be the best father. You want to be the best partner. You want to be the best friend. You want to be the best colleague at work. And that all starts by taking care of yourself. You can't take care of anyone else. You can't do anything for anyone else unless you take care of yourself. And I think that's what we're trying to teach each other now. And it's so important that you guys are doing what you're doing. You're all talking about this. And that's the importance of podcasts like this. And I'm so grateful for you guys for being brave enough and smart enough and cool enough to come on and talk about these things and normalizing them, because you inherently being here is motivating so many more men to go to the doctor, talk about their health, and address the concerns that they may be too embarrassed to talk about otherwise.
That's a great way to wrap us up, Doctor. I appreciate all that information. Thank you to all three of you for being here today. I look forward to just following you all along and watching you guys develop. It'll be so great to come back in a little while and just check in on updates with you guys. So thank you for your time today. And thank you for tuning in to Bold Enough to Ask. You can learn more about Breathe Strong CF by visiting breathestrongcf.org. Be sure to like and follow us and send us your questions to georgia@breathestrongcf.org. Special thanks to our episode producers, Georgia Brown and Catherine Russell. Branding and design by Rachel Rockwold. See you next time on Bold Enough to Ask. Hey everyone, this podcast is for educational purposes only and is not a substitute for professional medical advice. Always consult your physician or qualified healthcare provider with questions about your health.